Everyone, thank you so much for joining, and hope you all enjoying summer. I'd like to welcome you to the ACCA virtual talking series. My name is Veer Parmar. I'm a finance business partner at Chelsea and Westminster Trust, and I'm also vice chair for the ACCA Health Sector panel. Our topic today, as you know, is an insight to the use of AI in the health sector, and I'm really delighted to welcome our three guest speakers, which includes Bruno Bothelo, Ivan Jovanovic, and also Lynne Titley. So Bruno is the lead at Chelsea and Westminster for digital operations, and Ivan is a platform development at Palantir Technologies, and Palantir being a world-class AI company. So just a bit about our speakers. Bruno's going to cover basically the use of AI in the health sector, and Ivan will cover AI from the perspective of a software supplier. And lastly, we have Lynne Babcock. She'll be covering the use of financial systems, in particular the Power Query tool in Excel, just to give you guys a bit of an insight on how you can be automating your day-to-day jobs in your functions. So, hand over to you, Bruno.
Well, thank you, Veer, and good to see you, although I feel I see you every day at Chelsea as we discuss the business as usual. But my name is Bruno. Apart from being the director of digital operations and innovation at Chelsea, I'm also a nurse by background, and I do a lot of work on data platforms at the moment to support our business needs. As the role entails, I do have, apart from the clinical, the operational background, and my role is becoming very exciting, very enjoyable, but is nothing more than just try to understand the business challenges and how do I lead a number of teams and myself work within a leadership team to maximize the use of technology that is available to us or signal our intention to purchase or develop technologies that are needed to fulfill the business requirements. Going back a little bit, and probably I'm going to start sharing my screen as I talk you through, if that's okay. Hopefully you can see this at your end. There, I'll look at you to give me the sign if you don't. Within actually England, but within Chelsea and Westminster, or even Northwest London, the region is divided by systems. A lot of changes at the moment, but we operate in collaboration with three other big organizations together covering a population of 2.8 million and have about 33,000 staff. We have a single electronic patient record. We are working towards exploiting the opportunities with the NHS app, and probably the 10-year plan soon to be announced will exploit that in a more coherent way. But also coming back to that data platform where, as a result of some of the problems that we have been unable to resolve, in 2020, 2021, we started working in collaboration with NHS England and colleagues at Palantir Technologies on providing a state-of-the-art solution co-designed with subject matter experts in healthcare. So this is your frontline staff, your doctors, your nurses, people like yourself there, as an example, have inputted in these tools. Now, I'm going to take you through a couple of examples because I'm gonna let Ivan talk a bit more about the AI, which in essence is a byproduct of our ability to orchestrate and have the data in one place. Otherwise, the AI may not be able to function as efficient as we expect that to happen. Probably I don't need to say this to yourselves in your own environments. You know that fragmentation of data, lack of interoperability is quite often a daily theme within the NHS, especially for the clinical workforce, that is affecting the productivity and efficiency of our staff. There was an article in the BMJ a couple of years ago that alluded to 13.5 million hours lost annually from a doctor's workforce. So back in 2020, on the back of the deployment of an electronic patient record, which at that time we thought was going to be resolving a lot of our challenges, it did, some of them, but also exposed that actually we needed to do something, as the EPRs are only a part of the ecosystem of applications that we need to provide safe, better care for our patients, but care that needs to be looked at from a productivity efficiency agenda. That is probably now known to us in terms of the 3 shifts that the government is outlining: analog to digital, prevention to rather than treating, but also moving away patients into neighborhoods, into the communities, and only have the right patients coming to us in the acute. Likewise, having the right patients going to other services and not necessarily this ping pong of patients between systems. We worked very hard in 2020 with those doctors to come up with some of the solutions, and we were using a piece of the technology called Foundry provided by Palantir. Nothing more than a piece of software that sits on top of our local data investments, orchestrating a number of data points that then leverages some internal tools like the workshop, the contour, to provide a low-code, no-code environment for our users that will then create assets, your cohorting, your distribution, your scheduling function, and translate these assets into a layer of applications whereby the users, through a single sign-on, can manage the workflows with actionable insights. Our first product was called Inpatient CCS. CCS stands for Care Coordination. Our ability to very quickly look at historical data in theatres, but also look at the theatralization for the next few months. In this example that you have running on your screen, not only I can look into that theatre utilization, I can immediately do a deep dive into the sessions, and I can add cases, I can offer the sessions. Basically, we have eradicated multiple workflows, Excel spreadsheets that we had within the system, and we have been able to reduce meetings that traditionally would have taken 2 hours on a Tuesday afternoon to about 40 minutes to an hour. We saw the value because where teams are using the end-to-end workflow using this tool, we now have the ability to demonstrate that theatre utilization goes up by 7%. For the trusts that are utilizing these tools across England, together we have been able to treat about 6,500 to 7,000 patients more that otherwise will have been untreated. The benefits from this tool in 2020-2021 translated then into other concepts. Our ability to text and engage with patients, bringing together a text message integration, an integration with letters, so we address the digital inequality. When people are not responding to texts, we automatically post a letter to their address. This, again, was something that was clunky, needing Excel spreadsheets, a lot of people. Now, it requires 1 or 2 individuals to activate what is a very simple method for texting patients and receiving the automated responses within the workflow. In my world of operations, validation of pathways is a daily task, mainly as a result of poor data maintenance within the electronic patient records. This tool at the moment is enabling teams to be 2-3 times more productive, information is all in one place, and we have some enhancements coming with the use of AI that will read through the letters that have been generated in the system and summarize and augment what pathway the patient should be, and with that provide even a better tool for admin colleagues. If you pay attention to PMQ, you'll have heard the Prime Minister about 5 weeks ago referencing something related to our ability to provide better care for our patients in cancer, and he may have called these the Cancer 360. Again, another tool that was developed, bringing together not only the EPR system, but diagnostics, both imaging, radiology, histopathology, and bringing a third-party system called the Cancer Registry, Somerset, where users, again, now not only use one tool to manage cancer pathways, but we have the ability to look into the team performance, and within a couple of clicks, we are into patient level detail. You can see where I'm going with this, which is problem after problem. We've been trying to develop this tool to address issues within the organization, issues that also resonate with other organizations within the country. At the system level, once we have the ability to ingest data, we also have the ability to surface data for the system. At an ICS, as an example, the system control is enabling us to look at the ED performance. That's the example I'm using in this video, where I drop from trust to site or from site to trust. We have 12 hospitals managed by 4 organizations. See the performance, do action cards, and with that, negate the need for phone calls, emails, or actually a delay in the transmission of problems or situations that otherwise, perhaps by the time we were getting there, it will be too late. So early escalation of issues. At the national level, the ability to look into a view of the data. The platform does offer some privacy enhancing technology. Not everything that we see at the trust level is available to be seen outside the organization. And for that reason, leveraging the power of the federated data platform is also an opportunity for the national teams. In this example, I'm going to pull on the screen is the performance overview dashboard, where the NHS GP can access a dashboard that is currently very close to real time, but enables an overview, as an example, of the A&E performance in England, but very quickly drill down to an ICB or even to a provider level. Probably you're tired of hearing me, but finally we are getting to the AI. This is a tool that we've been working very hard over the past few months to support clinicians, but I will leave that to Ivan to tell us a little bit more about that.
Thanks, Bruno. So the perfect segue. Thank you all for the time today. Just the quickest of introductions. So I work as a AI platform strategist at Palantir. So I've actually sat kind of pretty broadly across the deployment of our AI platform in private, public sector, different use cases. But also, as you know, Bruno alluded to, it's really important and extra important in the age of AI to sit with, you know, where the experts are, where the users are. It's what we call forward deployed engineering. And so at the moment, I am forward deployed with Bruno and team at Chelsea and Westminster Hospital working on AI assisted discharge summaries. And I guess just given the audience, I can acknowledge that I have some basic knowledge of accounting. I started my career as an equity analyst. So have, as I said, at least, you know, some sympathy and understanding for what goes on in that space. Yeah, I'll dive into AI assisted discharge summaries and then kind of zoom out to explain again from our perspective what we think it takes to get AI and more broadly what we would call safe automation out into the world. So let me switch to screen sharing. So yeah, this is taking over from what you just saw on Bruno's slide. Pretty straightforward list of admissions. This is all notional data, by the way, which also means I'm going to end up a little bit limited in terms of what I can demonstrate, but bear with me and kind of we can use our imaginations to fill the gaps. So very simply, the key thing is to go and identify like who is it that needs a discharge summary, who's medically optimized, who needs to get out. It fits into that sort of much broader workflow that Bruno was showing you in terms of tracking patient journeys and making sure that the right thing happens at the right time to the right person. So suppose that we want to create a discharge summary here. At the moment, what you'll see is a kind of non-AI version, which is what we're using to make sure that we validate with doctors at Chelsea and Westminster that we're essentially going down the right lines. Like I have no medical background. I'm not an expert on, clinical notes or what should be in a discharge summary, and especially not across different specialties. And so again, this is where like there's this theme. It's really important to get two things right with AI. It's to get the data right, make sure that you're actually providing the right context. And then it's also really important to have a good understanding of like, what are the right outputs? What do you want? And that's essentially the purpose of this exercise as demonstrated on this screen. On the left, we have clinical notes. These are just fake ones, but when we've been doing this, as I say, with doctors at Chelsea, it's been a huge exercise to validate that, all the notes are coming through, that they're the correct notes, that they're presented correctly, that they're searchable, etc. Because even with AI in place, you will need to have that transparency in terms of the underlying data. And then on the right, this is, if you will, a kind of template. And to be clear, this is just for the narrative section of a discharge summary. Like EPRs do take care of a lot of the heavy lifting for us in terms of, structured details. And it's to say, actually, what is the information that needs to go into a discharge summary, right? Like we've broken it up into sections, but what is it that we need in each of those sections? And that then provides kind of dual guidance. It provides guidance to the doctor in terms of what are we expecting here, because again, as much as this is about saving time, it's also about improving quality. At the moment, discharge summaries are often done by, some of the most junior doctors in the ward, maybe in a bit of a rush, trying to get the doctor out. They're trying to get the patient out, excuse me. But equally really, really important. And as I say, we're going through that kind of exercise now to try and nail down like what is the right output that should be going in here. And once you layer AI on top, the idea is, and I'm sorry not to be able to show a live thing, but we don't have a notional data version of this, is to say, well, if you imagine that those boxes are now pre-filled, there are, two or three things that need to happen. The first and most obvious thing is to say, well, actually, where did this information come from? We have the clinical notes that have been referenced on the left and with references within that. The second thing that needs to happen is that, some things will be really obvious, have really obvious sources, say like the presenting complaint that the patient turned up with usually has lots and lots of references. There are other things which might have fewer references or be more contradictory. In this demo, that's presented as like a percentage information match. In practice, it's going to be a bit more qualitative. But again, that's where that guidance comes in. And then the third aspect is this isn't about full automation, far from it. This is very much about just assisting the doctor. There are, important pieces of information that are either, hard to extract or are just sort of verbally communicated in the ward, or actually they just want to communicate things differently. And so the key thing is that it is still an editor where they can write their own note. It does still have the capability to find whatever extra information they want to find on the left on the clinical side. So that gives you a sense of where we're going with AI assisted discharge summaries and the safety features that are involved. I think that like this is sort of one narrow view, as I say, of FDP and of the patient platform and of one application of AI. But as we think about like that broader question of like, what does it take to have safe automation? It comes back to that platform approach. And Bruno kind of showed a version of this, and for as long as we're in the health context, and then I'll kind of switch to a slightly different view for the audience. But it's this bit down here in the bottom right, which is what enables us to do what we're doing. It's about having this platform, the FDP, powered by Foundry, that is entirely interoperable, can connect to whatever your existing systems and data sources are. It's not about like reinventing the wheel. And then really where the magic happens is what we call the ontology layer, but it's this representation of things in a, if you will, kind of human-friendly way, right? And so we're saying, look, that we have the concept of a patient and all the information related to a patient, also all of the actions that can happen to a patient, which might be that, something, a vaccine or a test is ordered, an appointment is scheduled, they see certain clinicians, they, move between different sites, etc. And it is this layer which means that we can have the products that sit on top, which you saw Bruno run through, and then AI-assisted discharge summaries is just yet another one of those. But ultimately, it's all the same platform and the same one single investment that's happened, or that kind of happens iteratively to build that behind the scenes. So all of this becomes reusable. And then what's particularly exciting at an NHS level is that it's not just about one trust, about, say, Chelsea and Westminster having this representation. It's that now this kind of universal representation can exist at any trust that has FDP, which then means from a solutions perspective, whether it's AI-assisted discharge summaries or the products that Bruno was showing you, we can scale much more rapidly to achieve that impact, to get more patients booked in, to get more patients discharged safely on time, whatever it might be. And it's not just for the solutions that exist within the platform, but also this idea of external applications. So we already have third parties, whether it's sort of other software developers or startups or kind of innovation networks that can then leverage this to build their own solutions and scale them. And then the other side of it, and I guess maybe to kind of link to the accounting side, is that it enables secure and well-governed data sharing. And that's what these lines here are all about. So up here, this is what Bruno was showing you, the performance overview dashboard. That sits in a completely separate instance of the platform that exists at an NHS England level. And for example, we have growing sort of solutions and pieces of work which are really around automating the statutory reporting that has to happen from a trust or an ICB level over on the left up onto the NHS England level. And again, the point there is to say, well, just because stuff is integrated, and that's that safe part of safe automation, doesn't mean that it should be just kind of like sent around willy-nilly, especially not when it's health data. It is about scoping it down to sort of purpose-based, who needs to see what for which reason. And so thanks to the privacy enhancing technology, it means that like we don't have any patient data at a national level, and it's not allowed, and the technology guarantees that. But it also means that rather than reporting happening through 150 different teams submitting manually created Excels, which are then also manually collated on the national level, actually we can just get computers to do that for us. And I think that's where there's this broader kind of theme of automation, which really AI in some ways sort of is subsumed into in our eyes, where it's not necessarily about like, are you using AI or using large language models or not? It's about like, are you actually delivering the impact in a safe way, doing what's needed? And what AI just allows us to do is much more broadly open the scope of what it is that we can do, what kind of data we can interact with, what kind of sort of logic we can start accounting for in machines, rather than just relying on rote work. So this was kind of how I wanted to illustrate it in the health context, just kind of now zooming out briefly to think about it in other contexts and how we think about this as Palantir across a whole bunch of different sectors. So this is just very, very briefly to kind of give you a sense. So outside of our health work, which we're extremely proud of and is, I think, one of our single largest pieces of work as Palantir globally still, the software that we build, the platform that we have, is actually agnostic across all different sectors, both private companies and in the public sector. And we'd have to go through all of these, but it's just to give you a sense of kind of the breadth of it, from working with the National Grid through to BP and Rio Tinto and We have all kinds of interesting customers in the US who, chicken farmers and really anything you can think of. But this approach here that I illustrated in an NHS context really applies kind of across the board. And what we look for is to say, where can that safe integration and representation of your data allow you to push the boundary of what AI allows you to do? And I think where a lot of us are at the moment is with our co-pilots and our chat GPTs and so on, and those are starting to get integrations into your SharePoints, or this Teams meeting probably will be able to transcribe and get some actions out of. But ultimately, like in any organization, whether it's private or public sector, what it comes down to is decisions, right? Whether in a health context, we're talking about sort of the scheduling decisions, discharge decisions, communicating clinical information. It will also be around decisions of what to procure, how to deal with a supply chain disruption, etc. And so that's where we're really looking forward to say, how can we actually bring AI into our world in a more deeply integrated fashion so that we start getting decision guidance? And if I think about the AI-assisted discharge summaries, we're starting to get to that point where it's like, okay, well, there is some decision guidance, if you will, around like, hey, out of the hundreds of notes that a patient easily racks up within a week or two of being in hospital, where are the relevant bits of information and that you want to present in a discharge summary for communicating to onwards care. And then the ultimate expression of that is to have automation. Now, that's not where we're headed on AI-assisted discharge summaries, I kind of hasten to add, but there certainly are lots of opportunities in the world, and I talked about those statutory returns, and what AI allows us to do is actually start incorporating automation into areas where it's not just about that kind of like structured reporting, for example, but also where there is more unstructured information to deal with, whether it's text, whether it's like standard operating procedures, whether it is contracts, all kinds of things. And I'll very briefly, conscious of time, kind of touch on an example of that. So to facilitate this journey, it comes back to that ontology layer. So where I was previously showing you the sort of the health version of it, this is just to set us up for what might be more of like in the commercial space, the kind of thing we see. So you can think of this as a kind of slightly generic supply chain manufacturing example. We do actually have some work streams related to this in the NHS as well, to do with supply chain and procurement. But again, it's that idea of how do I, first of all, like represent my data in my world semantically. So that means that like I don't want to be thinking about tables and documents. I want to think about customers and costs and plants. Like what are the things that actually the concepts that matter to me that comes from my data sources. And then I need to think about like how do I encode the logic and the reasoning about that data. So if I was, for example, dealing with a supply chain disruption in a company, it's not just that I would need all of the facts of the matter and all of the data. I would also then, if we all kind of sat down in a meeting room and went, hey, how do we deal with the fact that like, this supplier has gone offline and we have to find a replacement? Well, we'd start reasoning through like what are our alternative suppliers, what are the trade-offs of, cost versus lead time versus, maybe there is an alternative, but who we haven't onboarded yet. And that's where that kind of logic point comes in. And as you're working through this is what then provides you the foundation to do contextual evaluation. So as I think about the AI-assisted discharge summaries example, like we're not just kind of shipping this once, giving it to the doctors and saying, cool, we've got some large language models that summarize this for you, have fun. It is absolutely essential that there is a continuous evaluation loop in their context where we still get that feedback where they say, hey, actually it didn't do a very good job of, extracting the full list of symptoms, or, it got a little bit confused about which of the follow-up actions were to happen in hospital versus at the GP. But it's only by having that feedback in the context of the real world that we can keep iterating on this and improving the quality and essentially kind of capture it more in this ontology form. And then ultimately it's about deploying it. And deploying it doesn't just mean putting it in the hands of decision makers, be it strategic ones or down at an operational level, but also means that they need to be able to take the actions that come as a result of these decisions. So you'll see that the examples here talk about, reallocation plans or changing work order statuses. And again, in the health context, some of the stuff that Bruno was showing you, we're talking about actually we need to schedule a patient in, right, for a session in theatre. And again, it's not just about like, oh, I now have maybe a dashboard that's helping me do that. It's like, no, I actually have the full end-to-end decision cycle that goes from get the data, reason about it with the logic, take the actions, and then have that kind of closed loop. And that means that the same thing can power human teams who are working through this, as well as then the LLMs that assist them. So in the closing minutes, I thought I'll go back down to a kind of a specific use case level, and one that I hope might resonate with what I assume is a pretty broad audience that we have today, and that's in the procurement space, where we I've been doing quite a lot of work, as I say, with a range of customers, including the NHS. But it's quite a neat way of demonstrating those maturity stages, where typically, the first thing that we'll find is that large language models and AI gives us a real opportunity to get structure out of unstructured data. So I'll have framework agreements with suppliers, and again, this is a completely notional version, and ultimately, like, it's just documents, right? I think we're all pretty familiar with this kind of thing. It will have terms, it will have tables, but at the moment, this is fundamentally only really human readable, and what I want to do is make it machine readable. Now, sure, the first level of LLM assistance would be that, I could have a little Q&A thing which says, like, what is the termination clause in this contract? But fundamentally, that is a very sort of limited interaction that I can have. Sorry, that is still reading my old question. In terms of I only have individual people interacting with this, at an individual level. Whereas what I want to do is see how can I introduce scale? And the answer is like, well, it's not about people having sort of little chats with a contract. It's about saying, no, I know what information I want to get out of that contract. What I care about is key clauses. And here they are, some of those that have been extracted. What I care about is any discounts that appear in a table. And now I actually have these available in a structured form that I can apply elsewhere. We'll see that in a second. And I have my rebate clauses and so on and so forth. So as I say, that's what, like, the age of AI has now opened up as that starting level to say, well, I can start introducing automation in terms of extracting information from these contracts. And then if I think about that integration layer, so I've integrated my contracts, but I can also integrate with my, with my ERPs, my procurement systems, and so on. And now I can start running reconciliations. And this is something that is, in the last kind of couple of years, been saving, I think in aggregate, we're getting to kind of hundreds of millions, but I know for some of the early customers, it was easily kind of tens of millions in the scope of months, which is to say, well, let's say, for example, here's like a delivery duration one, right? This is saying, where are violations happening against the contractual terms that we have across our, scores, if not hundreds and hundreds of suppliers. And we can do that because we can actually, from the other side, bring in purchase orders, we can bring in invoices, we can bring in receipts, etc. And then we can get the platform to actually review that against the clauses that we have from that contract extraction. And then going back to that point about decision making and taking action, I can close these alerts, I can open a vendor claim, and there's a nice little bit here where the AI will pre-write the email in a way that you can sort of imagine. But the point is that it's that integration which allows us to then make better decisions and take actions at the other side of it. And then, like, the sort of end game, if you will, of this is saying, well, actually, if we have sufficiently integrated the information that we need from different sources, we have sufficiently understood the logic that drives some of these decisions, based, for example, on how those decisions were previously made, and we have sufficiently evaluated the system in the context that it operates in, then we can get to a point where, for certain purchase requests, we can probably have partial or full automation. So again, bear with me, this is just sort of notional demo version, but the idea would be that I can now go in here and I can see, okay, someone has, sent in sort of email type thing saying, hey, I need, I need these light bulbs by a certain time. Let me know if we can do that. And now the procurement team can leverage the platform to actually pass that out into, well, what are they really looking for? We already have an understanding of like what light bulbs it is that we fit into our products or into our buildings, whatever it might be. In this instance, it's a manufacturing example. So we even have like a bill of materials integrated in to really understand like what exactly is it in a very like grounded, structured form, not just that, the LLM makes something up. And then we can go through and say, okay, well then based on previous choices for that particular material, like what are our vendor options? And then we can actually, with some guidance behind the scenes, get the AI to help us, suggest a vendor or some vendors. And in this case, we have a pending review because like there are some aspects that aren't clear. And again, therefore, in terms of the actions that I can take, I can always edit the order. I can go and select a different vendor, etc. And then have that written back into the system. Running out of time here, so I won't go into the full sort of behind the scenes, but you'll see here as well that there is the feedback option, which is again essential in terms of kind of getting that feedback and improvement over time for really any deployment of AI. All of our production deployments heavily rely on those feedback loops because it's just not possible to get this stuff right kind of in isolation as a software developer. It has to be heavily grounded in the reality of the world and the people using it. I'll pause there, but I hope that was helpful and interesting, and I hope also that it was useful to kind of expand a little wider in terms of how we think about this platform approach beyond just health.
Even that was really fascinating. I'm sure we'll have questions a bit later, and we can have a discussion. But I'll hand over the talk now to Lynne, who's going to cover the use of like Power Query to help us all automate some of our daily functions.
Sure. Hi Veer. Hi everybody. Just get the screen share going here. Hopefully you can see my screen. So yeah, Veer's explained what I'm going to be talking about today. So I'm conscious of time, I'll skip through some of the intros. Just to say I'm Lynne Titley. I'm a professional interim accountant. I've been using Excel for about 30 years. So some of us will have been recently taking advantage of some of the more kind of recent additions to Excel capability. And I'm going to demo one of those today, which is Power Query. So Power Query is an ETL tool, which stands for extract, transform, load, and it enables us to get data from a source somewhere, apply an automated routine to that data and present it for consumption in whatever way we need to. So the data I'm going to use for the demo is dummy data generated by Copilot, so there is a little AI link into this session. But the scenario is that I have 3 separate extracts from an ERP system, and I want to combine these data sets and make some changes, and I want to automate that routine so that I never have to do those kind of specified transformation steps manually again. I can codify that. So first I'm going to show you the extract part, which is the first step of the ETL process. And we also refer to that as get data. So if we go to the data menu, and this is core Excel functionality that everybody has access to, and you will be able to go away and do this yourselves this afternoon if you wanted to. So I'm going to go to get data from file, from folder. And I'm going to connect to a folder that I've just got with some sample data in it here. And open that up. And so this is going to present to me 3 files, as if we'd run a report from our ERP system once a month and drop them into a folder. And now we want to pull out all of that data into one single analytical output. I'm going to choose combine and transform data because I want to do some more work on the formatting after I've combined these files. And so Power Query is just pulling that stuff together for me. And what it's asking now is which bit of those files I want to combine. So my sample data for this demo is really simple. I only have 1 sheet in each workbook, and it's sheet 1. So I can just tell it that's the sheet that I want. I've got a very short amount of time with you today just to rush through because there's loads of things I won't be able to get to, but this is just a sample kind of demo. And Power Query goes away and builds the aggregation of those files. And it's now launched Power Query Editor, which is the application that sits in the back of Excel that you may never have seen, but is probably my favourite application in the world these days. So this is literally the data from the 3 source files. It's stacked one underneath the other, and you can see it's added over here on the left, a column telling me which source file it got each line of data from. So it's got the February file, and then if I scroll down far enough, it'll show the January and then the March. And this is a live connection to the source folder now. So if any of the source files change, this query would be able to be refreshed and the imported data would update to reflect whatever's in that folder. And not only that, but if someone added another monthly export, someone added April, you would be able to, again, to just hit refresh on this query and it would automatically pull in the content of that new file as well and tag it with the new file name in that column. Now, if that's all we wanted, just an aggregated sort of stacked data set, we could just load that to a worksheet in our file just by going to close and load. And it will populate those transaction lines in this file. And important to remember that this is a connection to that source file. So if that source file changes, you can just refresh. There's a number of ways. You can either right-click this table and refresh it, or you can go to the data menu and refresh. There's a couple of ways. But that's a live connection. Now, suppose we don't want it to look quite like this. We can do some more work on it before we load it to the sheet. So I can go back to this. This is where the query, the kind of entry point to Power Query Editor is, and I can go to edit that, take myself back into Power Query Editor. So say we've done the extract step of ETL now, and if we want to, we can do the transform piece, which means making some changes to the way this data is presented. And the important point to note here is that we're about to set up a routine that will be automatically rerun every time this query is refreshed. So whatever steps we code into here will repeat themselves every time you get a fresh source data set. The way we create Power Queries, at least to begin with, is to create what we call steps, which represent what we want to do to our data. And steps are recorded and shown on the right-hand side of the screen here in the Power Query Editor. So Power Query's already created the steps that represent the combination of the files for me up here, and it's applied a little bit of intelligence as well off the bat. It's guessed from the source files that the first row of those files is column headers, which is fine for our purposes today. I can leave that as is. You could adjust it if you needed to. Now I can do pretty much whatever I want with this data set within the confines of logic. So I know the data has data in it from 5 companies on my system. Suppose I'm only interested in a couple of those. Well, I can create another step now just to filter down on the companies I'm interested in. So if I just find company code, say I only work with these 2 companies. I can just filter on those. And suppose I'm only interested in a few fields for the analysis that I'm going to want to do and load into a sheet. So suppose I need half a dozen. I'm going to pick project code, vendor name, quantity, total cost, posting date, and approval status are the ones. Oh, too far. And it's over here. So I just want those fields so I can make a step to remove anything else that appears because that's just noise. And it's going to clutter, so I can go remove other columns. And that will just keep the ones that I'm interested in and analysing. And suppose I'm not really interested actually in posting date. Suppose I'm interested in posting month and I want to be able kind of to do some analysis that groups that way. So I've got various options up in this ribbon. And this is why I say it's a brilliant application because it's so well designed that you can access so many different transformation steps via these very few menu bars. And one of these is an example. Is in the transform ribbon, there's date and time actions, and I can pick date. Oh, I'm sorry, I need to pick a column. I can pick the posting date, and then I can pick date and month and convert that to the end of the month. And then all of those dates will just flip to the last day of the appropriate month. And then because I've changed the content of that column, I probably want to relabel this to make it accurate to say, actually, this is now posting month. And all the time I'm doing these steps, Power Query is recording code in the background to reflect what's happening. And then maybe for the analysis I'm doing, I'm going to put another filter on now. I'm only interested in approved transactions. Just simple examples. There's hundreds of thousands of things you can do, but suppose I want that. And then because I've only got approved transactions, there's probably no point in having that column anymore. So I could just remove that column. Remove column. And then another thing Power Query can do is it can calculate columns on pretty much any logical basis you can code. So in this example, we've got a total cost and we've got a quantity, but we don't have a unit cost or kind of an average unit cost column. So we could add that as a calculation. So I'll just go to the add column ribbon here, custom column, and I'll call it average cost, and I can calculate it as total cost divided by quantity. Okay, and that will have me in that calculated column. And lastly, suppose I want my columns in a different order when I load them to a sheet. Well, I can just drag and drop them. So I can drag posting month over here, vendor name maybe. Suppose that's all I wanted to do for these purposes. I could load that to a worksheet. Close and load. And this is the load. The third step of the extract, transform, load process is the load, and it's how you've got options on how you load. So I've just loaded it to a sheet there, and notice you've only got 140 rows now because of the filters that we've put on instead of the 1,000 rows that we started with. And if as I say, if somebody adds an April file to that source folder at some point in the future, all we'd need to do would be save this work, but kind of open it back up when we want to refresh it, and just right click and refresh, and it will factor in the April data and apply all of those transformations that I've just done without me needing to do anything else. If I don't actually want to see the data on the sheet, that's fine. I have some options. So I can just load it as what we call a connection only query. So load to only create connection, and it will disappear from this worksheet, but my data is not gone. My data is still sitting, the code and the data sitting in the background of this file. So if I go back to edit the query, you'll see that the data is still there and the connection is still there. And then if I close that, I can load a couple of different ways. I could load to a pivot table report if I wanted to. And this is a pivot table, and you can see the fields that we created in the Power Query. And I could just create a conventional pivot table with maybe vendor in the rows and cost in the values and month in the columns. And there you've got a pivot table that is again connected to your source folder. And that's a super simple example in 10 minutes flat of a transformation in Power Query. So aggregating data from multiple sources is a great example of a use case. You might have 20 system reports or 20 kind of user entry spreadsheets, and you want to automate the pulling together of all of that data, but it can also handle really complex transformations on just one source file. It can handle many millions of rows of data. You don't have to limit yourself to the number of the kind of 1.5 million rows Excel worksheet. You can also get data into Power Query from other applications, SQL databases, or from the web. So it's a super powerful application. And that is pretty much the end of today's demo. I would just say, if you'd like to learn more about Power Query, I would recommend going to YouTube and looking up the likes of Mark Proctor, Wynne Hopkins, Minda Tracy, Layla Gorani. There's a variety of Excel influencers, and they post really good training videos regularly that can help you learn many modern Excel techniques, not just Power Query. There you go, Veer, I'll hand back to you.
Thank you, Lynn. That's really like an insight. So before I hand over to questions, I've just got a question each to ask all of you, and then I'll hand it over to the floor. So for Bruno, based on your insight, which again was quite really insightful, could you sort of outline what you think are the challenges ahead in the next few years?
So I think, well, there's a few, but I have to say that our biggest challenge at the moment is not tech, because what you have seen is probably a state-of-the-art capability that perhaps has been embedded in businesses outside healthcare, and we are starting to embed them within healthcare, is the cultural shift that needs to happen to adopt, to embrace, and to exploit this opportunity. So people is my biggest risk with the cultural shift that is needed on our workforce. Okay,
cool. And Ivan, again, thank you so much for doing your piece. Again, it's really like an eye-opener. I guess for me, it's really about the backdrop that the technology is so fast moving. Literally within the last 3 years, the landscape's changed so much. So I guess what I'm thinking about is, what does the future look like in the next 3 years? Whatever we do now, what's the resilience in these systems, the development? Will it change so much? And it's just kind of like that future look, given the pace of change.
Yeah, I think that obviously in some ways, these kind of brand new horizons that have opened with the latest generation of AI and these foundation models, which are these kind of very general purpose, powerful models. And I think what's exciting about that is that it has really democratized access to that really powerful technology, right? Like ChatGPT was a runaway success because it was suddenly so accessible. Like anyone can go and use natural language, right? And even as we develop some of these sort of more sophisticated workflows, like the couple that I showed you today, whether it's some discharge summaries or managing procurement related things, behind the scenes it's still very accessible, and the only way to get it to actually work is to spend time with non-technical experts. So it's really sort of flipped the script a little bit on, previously I've done more traditional machine learning stuff, not directly myself, but working with machine learning engineers. And it's, you need like a PhD in AI to even get close to it. And so for me now, what it comes down to is that bit like what Bruno said, it's the adoption pathways. Like, how do we actually make this useful and work for people? It's not just about shiny tech. I receive emails every day from different AI newsletters on like, this is the new exciting thing, but like it all kind of exists in a vacuum. It's about how we actually make it applicable and useful to real people in the real world. And I think that is the key challenge and opportunity for us. But I'm certainly quite optimistic that, by virtue of this being something that can be applied in quite a generalized way and in an accessible way for non-technical folks, that it means that there's suddenly sort of so much more that we can do than before, when it was much more gate kept.
Okay, great. And then Lynne, the question for you. Again, thank you for so much for doing your piece. You've got a proven track record in factual systems and development. So just wondering, in your kind of like lens, what you've kind of observed in the way that these innovations, these tools, these apps have like transformed finance departments. So
Sure. So
yeah.
Go on. Sorry. Go on.
No, yeah, you take the floor.
In terms of sort of cloud-based planning applications and that kind of thing, the sort of next generation tools, I think there's kind of a lead time. They are difficult to quantify in terms of the benefits for business case. So kind of a lot of organisations hesitate, I think. There's also an element in finance teams of BAU constantly being quite kind of high workload and capacity to make space for some of those tech implementations is tricky. So I think just touching on the Power Query thing, I think what we've got on our desktops is some real kind of low-hanging fruit in terms of ability to streamline and speed up some of the day-to-day work that we do to carve out a bit more time to think about what the right answer is in terms of systems implementation, systems upgrades, system adoption. So I think, yeah, it's something that people do find hard in terms, generally, is my experience, in terms of implementing sort of major enterprise grade sort of technologies. But I think it's coming at it from both ends, having that ambition and looking to the future and sort of AI enabled planning tools and so forth. But at the same time, don't forget that on your desktop today, there are some opportunities for you to do things smarter, to carve out a bit more time to think and do that bigger picture work, if that helps.
Okay, great. And just one last question on my part before I hand over to our audience. Just for all three of you, what do you think are the risks in this technology moving forwards? Or are there any risks?
Are you talking about AI technology specifically?
It's over to Ivan, you, Lynne, and also Bruno.
I can touch on the first bit on AI, where of course there are risks undoubtedly, and we read a lot about that in the press as well. I think that, again, as with any technology, really, but this obviously brings sort of new capabilities. It's the risk of applying it badly or having mismatched expectations, right? Like it is important to have the right guardrails in place, the right expectations in terms of what it can and can't do. And I think so where I see the risks is where people try to use it for things that it's not intended for. So for example, large language models, great at kind of working within actual context that's provided to them, terrible as stores of knowledge on their own, right? Like that's not what they're there for. They're not there to be calculators. So it's it's about using the right, as much as powerful as it is, it's about using the right thing for the right task.
Okay,
I think
great.
just really quickly on the Power Query side of things, I think the risk with Power Query is that you tend to get specialists who are able to work and do quite progressive things with Power Query. But if you don't have that resilience across your finance community, maybe someone leaves and they leave in a state of Power Query that's not supported, that's not got enough kind of community understanding and awareness to if something goes wrong with something one day or something changes in a source data set and your BAU process falls over because you don't have enough capability and understanding in the community to support those tools. That would be, I guess, the risk from this point of view.
Great. Okay, so we've got about 3 minutes left, and I'll hand the floor to any questions.
Everybody's a bit stunned.
Well, I'm sure everyone's quite fascinated by the depth of like all three of your pieces. So again, if there are no more questions, then I want to thank all three of you so much for taking your time to provide an overview to our members. I think it's a really amazing area, AI. It's transforming everything we do, and I think it's a really exciting area to watch this space. And I want to thank you all so much.